Hi, my name's Steve Kilburn. I am the director of the Chautauqua Substance Abuse Response Partnership. And we are a collaborative team of providers from across the county, prevention, treatment, recovery, harm reduction agencies, all working very closely together to combat addiction here in Chautauqua County. We have taken this season of change for all of us, very different circumstances that we find ourselves in, but we've put together some videos so that we can let the members of the Chautauqua Substance Abuse Response Partnership share with the community what's going on, what services are still being offered, and to connect with the people that they serve. I'm very happy today that we are connecting remotely with Melanie Witkowski from Prevention Works. Hi, Melanie.
Hello, how are you doing today?
I'm doing well. Thank you. So, Melanie, tell us about your role at Prevention Works and about the services that Prevention Works offers.
Sure. So I'm Melanie Witkowski. I'm the Executive Director of Prevention Works. We were formerly called Chautauqua Alcoholism and Substance Abuse Council. We provide basically some social emotional learning as well as substance use prevention with children as well as adults and seniors throughout all of Chautauqua County. So our mission is basically to build a safe and healthy environment by effectively educating the community on positive life choices.
You know, I want to say, having gotten to know the services of Prevention Works even better here in my role as the director of this federal grant, and come to appreciate just how crucial a role Prevention Works plays here in our county. I know that all of us are concerned about addiction and the opioid crisis here in Chautauqua County, but what better approach towards this issue of addiction than to work on prevention, to get upstream from this issue. And this is exactly what Prevention Works does and does so well. You're in the schools, for example. You have educators in, I think, how many school districts now?
So we participate in almost all 18 school districts in some capacity, but we have school districts that we provide K through 12 programming. So each grade level is a different curriculum, age appropriate. And all of these are evidence-based prevention programs that are approved by the Office of Addiction and Support Services through the state, as well as SAMHSA. And so we've been providing this program. We've been slowly increased over the past 4 years to provide programs throughout all 18 school districts.
18 school districts.
We collaborate with youth organizations as well as pediatrician's office, family care doctors' offices. So we're receiving a lot of referrals from youth that are 12 to 19 years old that might be mild to moderately using. So it's sort of that brief intervention and a harm reduction program to hopefully prevent them from going on the curve of, or the spectrum of having a substance use disorder.
Right. Well, again, it's hard to imagine more important work going on behalf of addressing addiction here in our county than working with our young people and, like you said, seeking to avoid substance use disorder altogether. Well, what's new, different, or maybe the same about Prevention Work services now during the coronavirus crisis?
So I first off want to say thank you so much to all the healthcare providers, those at the front line, first responders,
yes,
those working in childcare, and our people that are helping our first responders, youth, their children, that are dealing with it firsthand in
yes,
crisis mode right now. So thank you all to all those that are helping, and all our foundations, United Way, CCRF, and all the other foundations in our community that are helping, all the nonprofits out there. So right now, Prevention Works and what we do, right now our office doors are closed, but that doesn't mean we're not meeting and reaching out to people virtually. So a couple things that we are providing right now, we're continuing with our Teen Intervene Brief Intervention Program. So if you do have any individual, a student, a youth, your child that's between the ages of 12 and 19 years old, we will meet through teleconferencing and still providing that service. So anybody that's using mild to moderately, maybe they're experimenting with alcohol, marijuana, or another substance, please reach out to us. You can actually go on our website at preventionworks.us and go to youth programs, and you can actually fill out a self-referral. A teacher, another individual, youth agency can actually fill out the referral form right online. We also are accepting referrals from Jamestown Pediatric and Southern Tier Pediatrics. We have a memorandum of understanding and working with those patients that are referred over to us. So that's still happening. So please, especially during this time when youth might be struggling a little bit, please reach out to us. We can also be reached at our phone number at 716-366-4623, as well as our Jamestown office at 664-3608. And they are being transferred to another phone number. So that's still happening, still occurring. Something that's been put on pause right now is our parenting program. But I'm happy to say after yesterday, we worked through some kinks. We've got approval from the developer that we will now be able to have some Zoom meetings for our Active Parenting Now program that's normally occurring at the Mental Health Association. So we have 15 participants right now that are signed up for that program. But if we have a couple more slots, so if you are interested, reach out to our agency. We can get them signed up, give them the Zoom link so that they can participate. And that's for parents that have children between the ages of 5 and 12 years old. The other thing that is going on that's kind of a change and on hold is our PACS Good Behavior Game. That is a program that is, we're working in the schools, we're working with those kids, and it's obviously can't be done with all the schools closed. So our PACS team and PACS stands for Peace, is actually working on developing a webinar that's called the PACS Community Tools Training. It will be for parents, especially with a lot of parents homeschooling and having to work as well as be their teacher. There will be a lot of strategies and techniques and tools that parents can use, teachers can use, individuals that work with youth, that are youth facilitators. That training is going to help improve cooperation, building relationships with your children, building relationships with their siblings. It will also focus on self-regulation, so helping youth how during this time especially can they self-regulate their emotions when they might be a little stressed or dealing with some coping mechanisms struggles right now. So also the ability to create a nurturing environment for their family and their homes.
It's really an opportunity for families and others to access these great services that you folks provide there.
Yeah, and it's really a tangible training. We're going to give you about 8 different tools that you can actually implement right in your homes.
Very practical.
Concrete stuff that they can use now.
Oh, so, terrific. That's great.
A couple other things that are kind of expanded. We just ended our poster contest, but we decided to open it up again because we haven't even had the ceremony. We haven't even done the judging. So we figure kids might be looking for something to do. So if you have a child that's in 3rd through 12th grade, they can participate in our poster contest. The guidelines are all on our website. The only change that has happened is it doesn't matter what size paper you use. It can be an 8x11 regular plain sheet of paper, because we know that some kids might not have access to the larger paper. So our theme is prevention works. How does our community pro-social health, promoting healthy behaviors, how is that important to reducing substance use in our community? So you can send that all the way to June 1st to our Jamestown office. And then we have one more thing that's still occurring. So we also provide a lot of trainings for our community and professionals. So we have a ton of online trainings that not only the workforce can tap into, but also parents. So we have online trainings that you can access right on our webpage. And we have something on the marijuana and the adolescent brain. We have the electronic nicotine delivery devices, so our e-cigarettes, juuling devices, a really excellent training on that. That's we partnered with Tobacco Reality Checks with Ken Dahlgren. And then we also have stress management, which I know we all could utilize right now, as well as a training on children living in a chemically dependent home. It's called I'm Hurting Too. And then lastly, we will be coming up with a gambling prevention training as well, especially when people are home right now and might be
Yes.
utilizing online gaming devices. We really thought it was important to do a training on that. So that will be coming up in the near future.
Well, again, quite an array of programs, services, education, resources, and obviously very timely and very applicable and practical to issues that are going on, in so many lives. And during this time, on the one hand, I have referred to it as a time of opportunity, but it is also a time of risk and danger, where isolation and perhaps loneliness can set in, and we want to do what we can to help people through that time. Yeah.
Absolutely.
How about you? How are you and your family coping through these different times?
We are doing well. We took this as an opportunity to do a family project. So we actually are renovating our kitchen as a family. And so it's become a family project that we can be proud of and look at into the future. So we're holding up well.
Well, Melanie, thank you so much. First of all, thank you and all of the staff at Prevention Works for really the crucial work that you folks are doing, and getting ahead, as I've said, of the issues related to addiction. And it's not just just say no. That's not the prevention sort of approach that's taken today. It's really building up life skills, isn't it? And making an environment for strong and healthy young people to become strong and healthy adults. Any maybe final words that you'd like to share with the community?
I just want to say, everybody, let's see this as an opportunity, and be creative and be innovative and think how this can turn into a positive on expanding our services in our community. And I hope everybody's safe and well, and please take care.
Well, again, Melanie, thank you. And thanks to everyone for watching this next installment of our videos. Stay well.